Well, you may be thinking about going shopping for summer clothes or even that bikini or swimsuit, but are you ready to show that much skin? Dr. Drshelenalaljiesthetics with Dr. Shel Wellness and Medical Center in Sugar Land here with me this morning with some treatment options. Good morning, Dr. Shel.
Good morning. How are you?
Thanks so much for being here.
Thank you. It's my pleasure.
You know, this is always kind of a painful topic,
yes.
Getting our body ready for summer. And we're talking, let's first of all talk about varicose veins.
Okay.
Are these kind of like, I mean, this is something that needs to be medically removed. I mean, we can't do anything else but, right?
Exactly. A lot of women deal with these issues, especially after childbirth, and then we all tend to have these spider veins, telangiectasias, varicose veins, and it is difficult because when we want to get into our bathing suits, we need to remove them. So a couple of different options that are out there. First of all, there's laser vein treatments, which is a great option because it's non-invasive,
okay,
it's non-surgical, no downtime, and it really is very effective.
And what we're looking on the screen obviously is a before.
Exactly, exactly.
Okay. And then I think we have an after.
Exactly. And that's after 2 treatments with the laser therapy.
That's pretty amazing.
It is. It really is quite amazing because what the laser does is it actually delivers pulse light energy, and that pulse light energy coagulates or clots the blood in the vessel, and then the vessel is reabsorbed by the body.
All right. Get rid of that unsightly marks.
Exactly. Exactly.
And there's other areas too, like let's talk about maybe the ab or belly.
Exactly. Well, you know, what happens is a lot of us have some areas of laxity, loose skin that we want to get rid of. So that can happen on the belly, that can happen on the face, chin, jawline, etc. So there's a great laser out known as the Titan. I don't know if you've heard of it, but Titan skin tightening is really quite the buzz right now. Okay. And the Titan is a great laser because, again, it's non-invasive, it's safe, it's effective, and it's quick. So really a pain-free procedure that involves no surgery, non-invasive techniques, delivering light energy to exactly do just that, is to tighten the skin.
And I know that we also have a photograph of the neck, if we can take a look at and kind of explain the before and after for us.
And that's the before picture as you're seeing on the screen, and that's, you see all the laxity on the neck, and then when you go through the Titan skin procedure, you actually see the tightening of the collagen, and that's what it's doing. It's tightening the collagen and reintroducing tighter, deeper collagen.
That's pretty amazing, and that's non-invasive. I mean, you would think that she had a lift of some sort.
Absolutely, absolutely. You would think that because the results are dramatic.
How many treatments did she have?
2.
Just 2? That's
just
pretty
2
amazing.
treatments, about 6 weeks apart.
Okay, and I know you have an amazing website as well because I've already checked it out.
Thank you.
Gotta look at that stuff.
Thank you.
What's the address?
It's www.drshel.com.
Great. Well, Dr. Shel, thanks so much for coming in. I know it's great information, getting our body from head to toe in shape for summer. It's painful.
That's right. It's
painful to talk about, not painful to get.
Not painful to do. That's
Thanks so much for coming in. We appreciate it. Welcome back. This is Women's Health Week, and an issue a lot of women face is hormone therapy. Here to tell us more about the topic is our friend, Dr. Shel. Thanks so much for coming back in.
Thank you for having me.
Good to see you again.
Great to see you, Courtney.
You know, over the last, I guess, couple of years, we've heard some good things, some bad things about hormone replacement. Where are we today as far as research?
Well, the research is great. There is a lot of research that has been done and is continuing to be done, and a lot of it is, you know, there are thousands of women right now who are on hormone replacement. And what you really need to look at is we need to give our female patients as well as our male patients a good quality of life, and that's what they're really lacking. We have made great advances in the medical world, but in the new era, in this new millennium, there is a lot that we need to know, that we need to tell the public about hormones, because it's really about the balance of hormones, nutrition, exercise, a great diet that really leads to a great quality of life.
Now, typically we mention this maybe for older women. I mean, is there a stage in life when maybe we need to start looking at this, maybe not necessarily later in life?
Definitely, definitely. That's a great question, Courtney, because there are women who come to me in their 30s, and a lot of times this happens after you've gone through reproduction. So once you've had your babies, you know that there is a huge fluctuation in your hormones, and your progesterone levels decrease dramatically at that time. So a lot of women are ending up in what we call the estrogen dominant stage. And that stage is where we have a lot of irritability, we have fatigue, we have decreased sex drive, mood swings, depression. These are things that really don't allow us to have a good quality of life. And once we can just balance the hormones, add a little natural progesterone to these women in a form that can be absorbed and readily recognized by the body's own receptors, which is why natural is very important, we can certainly enhance this balance and give them that quality that they're looking for.
Okay, very interesting. Now, you brought with you lots of books, so the point is there's a lot of information out there.
Definitely. A lot of information out there. There is a lot of good information out there. Now, obviously, if you look in the wrong places, you're not going to get good information, but great books that are out. We need to really look at the fact that nutrition is very important. To test for nutrition, we need to know which vitamins and minerals we're deficient in. There's a fabulous test out that does that we offer. You also need to be tested for hormones. We need to do a saliva test or a blood test in different cases to check your estrogen, progesterone, thyroid, testosterone, cortisol, all the levels of the hormones that really promote healthy living and optimal health.
Great. And we are talking about bioidentical hormones.
That's
so real quick, we only have about 30 seconds left on this topic. Can you explain that?
Bioidentical hormones, by definition, is a hormone that is biologically identical to what the body produces. Therefore, we can recognize it, we can absorb it, and we can utilize it to enhance health.
Awesome. Well, you're going to come back in a little bit talking about another topic.
That's right.
On
3D skin rejuvenation.
There you go. I knew I had rejuvenation in there, so we'll have more information. Dr. Shel will be back, and of course your office is in Sugar Land. So thanks so much. Great to see you.
Thank you for having me. Thanks.
We'll see you back in just a minute. Welcome back. Changing the look of your skin can be as simple as a trip to the doctor and non-invasive. That's good news. Here to tell us more about photo skin rejuvenation is Dr. Drshelenalaljiesthetics and Dr. Shel. That's what we call you. Welcome back. Thanks again for being here. Let's talk about skin rejuvenation. What exactly is this?
Well, this particular approach is a 3D skin rejuvenation approach. And what it is it's a multi-tiered or a three-tiered approach, really addressing 3 different layers of the skin. So we have the collagen, the dermis, and the epidermis.
Okay.
The collagen, we want to tighten the skin and just lift it up and tighten that skin versus having to have a facelift. Secondly, we want to get rid of the large pores, the fine lines, the wrinkles, the texture, and then finally the pigmentations, the sunspots, age spots, sun damage, and the redness.
Okay, so some of the things that we're seeing where we want to color correct and all that kind of stuff.
That's right. You want to address the tone, texture, and the tightness.
Okay, and so no downtime, that's the important thing.
No downtime. It's really important for women who are out there working and just want to get back to their lives. It's extremely important, and so there is no downtime. You go in, you go right back to work or your daily activities, and you're done.
Let's take a look at some before and afters, because I know you brought some in with you, and I think we can talk about the benefits here. This one, obviously, what I can see here is red cheeks on the left and not red on the right.
That's correct. You have a woman with a lot of rosacea and texture issues on the skin. So this lady had a 2D skin rejuvenation done with a laser genesis as well as an IPL limelight photofacial.
Okay, and one treatment, or you need a couple? It probably depends on...
A few treatments depending on the issues.
Okay.
So and the treatments can be spaced apart 2 to 4 weeks apart, but you see significant improvement in the results as the treatments go along.
Sure. Okay, and I think we have the next before and after too.
This individual had actually the entire 3D skin rejuvenation done. So as you can see under the neck, you've got a nice little pull under the neck, along the cheeks, as well as the jowls. And the skin tightening procedure did great dramatic results for her.
Okay, yeah, that looks really good. You totally see a difference. And let's bring up the next one.
Okay.
And then we'll talk about something else here. This is really interesting too.
This is wonderful. She actually had a 3D skin rejuvenation done as well with the tighten. If you can look at her neck and the jowls and the cheeks, as well as her texture is much improved, and so is her tone.
Okay. Now, I know that we're saying non-invasive, but what does a procedure like this feel like? Well, you may be thinking about going shopping for summer clothes or even that bikini or swimsuit, but are you ready to show that much skin? Dr. Drshelenalaljiesthetics with Dr. Shel Wellness and Medical Center in Sugar Land here with me this morning with some treatment options. Good morning, Dr. Shel.
Good morning. How are you?
Thanks so much for being here.
Thank you. It's my pleasure.
You know, this is always kind of a painful topic, getting our body ready for summer, and we're talking, let's first of all talk about varicose veins.
Okay.
Are these kind of like, I mean, this is